Hello, class. This is Randy Gaines recording today. I am going to be answering our questions for the second week. The sources are going to be the ANA Code of Ethics for Nurses with Interpretive Statements, Silver Springs, Maryland. The Addressing Food Insecurity and Vulnerable Populations by the American Journal of Nursing, and our LambTech's Care Coordination, the Game Changer, How Nursing is Revolutionizing Quality Care. So the questions this week were review the section on effective care coordination. What are the skills essential for nurses to develop effective care programs? Pick a minimum of 3 to discuss. And to err as humans, so they say to consider the following. Is it error or neglect of the healthcare system to not address issues outside the walls of the hospital? Okay, so the first question was, what are the skills essential for nurses to develop effective care programs? I picked community resources, knowledge of health insurance and benefits, interpersonal communications, and education and culture. Oh, coaching, I'm sorry. Um, so I actually said when I read the book and the article, the reason I picked the ones that I picked, the community resources, the knowledge of health insurance, interpersonal communication, and education. Whenever we're serving from a community standpoint, or in this particular reason, or what we're talking about, you have to have good interpersonal communication because you have to actually communicate with other people that may not be nurses. So whether you're talking to the doctors, other specialties, respiratory, whoever you're coordinating care with, you have to have the skills to actually be able to advocate, plus use these people or keep these people as resources in order for you to do your job. So the communication between all of them, whether it be written or verbal, you have to have very good communication skills, because if you don't, or people think you have a bad attitude and they develop a thing where it's like, I hate when she calls, or I don't want to work with her, that actually is counterproductive for getting work done with your patients. Um, Community resources is really important because there's not usually just one place that covers everything. So having these resources, the more resources you have, the more effective you are for your patient demographic, the people that you're trying to help. So it's important for you to foster those contacts, which means you usually have to go to um, community meetings so you can actually socialize. When I was actually doing case management in Greensboro, I actually went to different events where there were going to be other acting nurses or whatever. And we met people from social services. We met people from that had like homeless programs and different things like that that we could coordinate and get use take our people that we had in our program and help connect them to those resources, which actually helped. Oh, I'm sorry. Acting is the nurse for acting is the point is to make people not health mental health people not rotate into the ER so much. So we hook them up with services, whether it be we had vocational rehab, getting them in school. We had peer support specialists. So like if they had addictions or anything else, that person went and saw them, spent so much time with them to try to help them not relapse and kind of keep them on the straight and narrow. Then you had the nurse, which was me, who coordinated like doctor's appointments, made sure people were actually taking their medications. Um, and they had the actual resources. I also was the team lead, which is a separate position. So I had to come in and give everybody their assignments and work with everybody collectively, um, and do the initial assessments at the hospital for if a person, if the hospital thought that they had a person that would fit my criteria, I would go meet with the person and see if they were an actual candidate for to be helped by our program. And if they were not, we also had a community sport team, and we would transfer them down because that's the next down level of care for that person. Knowledge of health insurance benefits is important because a lot of lay people don't know how insurance works. Like a lot of people have insurance and still doesn't know it works. You just have it through work or whatever. And if you never use it or utilize it a lot, which a lot of people don't, especially if you're younger or and if you don't have kids or whatever, you just have insurance because they tell you to. Um, so having someone that can help navigate and answer questions, that makes you super awesome to the patients that you serve. Um, and then of course the education and coaching. You have to make your patients buy in to keeping themselves healthy. If you're not able to communicate and effectively get them to coordinate and to make lifestyle changes and for them to actually see the benefit in doing so, it's just like a rat race. Like it's just gonna go endless. Um, so the education and keeping them up to date and showing them values to the treatment is paramount. So I'm gonna go to the second question to err as humans. So they say consider the following: is it error or neglect of the healthcare system not to address outside the walls? So that question was different for me. Um, I took that even reading the article. It sounds really good on paper that we should be able to help people secure food because that is a big consideration, as to why some people end up in the hospital is their dietary needs are not being met. The dietary needs not being met can cause stress because they're thinking about it. It can sorry, they're thinking about how to provide for their families, for themselves. It can cause depression because you're, you know, coming up short. Um, One of the things that I noticed that the article didn't really cover was there is a stigma associated with receiving benefits, and a lot of people um, don't like feeling like they're getting handouts or having to even get benefits makes them feel like they're inadequate. And then you have some healthcare professionals that, it really is an attitude of, well, if it was together, if you were together, then you wouldn't need the assistance to begin with. So that may actually keep people from asking for assistance, and it may even keep them from telling you about needing assistance, because it can be embarrassing because of the response that other people have to it. Um, so, it, in order to get those people to want to use services and to effectively use services, you know, and for the service to be available. So there's plenty of community um, outreaches and giveaways and food pantries and stuff. Now, some people utilize them. Some people actually abuse it. Some people are getting it that don't need it, but you know that that's the good and bad of it. Um, and again, so it's just kind of weird that we can't really do it, and then it's so many dietary um, restrictions, and then some people just don't like they don't like the free food that's given. So yeah, you can have giveaways, but if it's not stuff that they want to eat. Some people will take it and just not do anything with it because it's not to their liking. We have gotten pretty sophisticated in our likes of food and what we and some people don't like healthy stuff. Um, you trying to give them vegetables is just kind of like I don't eat vegetables. Like I've come across a lot of people say they don't drink water like ever. And to me I'm like how do your kidneys work? But whatever, I digress. So anyway, but to address food insecurities, we need to, well, or excuse me, we need to address it because it's causing different problems like the obesity. People are our obesity and hypertension is out of control. It can cause low birth weights. Again, people are depressed because either they're not getting food or or getting the food, like working multiple jobs in order to afford stuff. Then you have I think they said veterans and elderly who can't necessarily work and might be on retirement or whatever. You know, they have hospital bills that they have to think of, and if I got to worry about a hospital bill versus got to worry about a hospital bill versus, you know, paying for my medication, I'm going to go with my medication. So stuff has to be available, and it we really do need to do better with making things available. I'm just not sure that the hospitals can actually take that responsibility. I know the Atrium Health, because that's where I work, we have a partnership with Food Lion, and they do the bag food that they give away at different points in time during the year to needy families and to kids. I forget which school they said it goes to, but different schools in Charlotte and different areas where Atrium Health is. So people are trying to address it, and Novant actually has something a similar partnership to where they actually provide food bags to the different schools. Um, so that is the end of my message, and I guess I'll be talking to y'all next week.